Lipkin, I'm going to start with you both because, and Dr. Devi, I'll let you start because you see something in the RFK appointment that you are fine with. Tell us what it is.
Well, I think the first question is, what are we trying to accomplish with healthcare at all, which is to increase life expectancy, and then when you have more years, to have more quality of life within those years. So that goes beyond just vaccines. That involves so many things. Our biggest killers are heart disease, cancer, cardiovascular problems, unintentional injuries. And the biggest barrier for people is really healthcare costs, that there's the direct cost where we have technology like robotics and AI, regenerative medicine, but it's not accessible to people. And then we have other barriers where even the people who might be able to get towards it, where they have insurance, they can't afford co-insurances, deductibles, the indirect costs of transportation, and there's various biases and disparities. So my priority would be, is this person able to do that? And I think he can address some of those things. And part of it is because he expresses a degree of skepticism, which I think we could use. It's been several decades that, we've had poor healthcare outcomes compared to the amount of money that we spend on healthcare. And so maybe we can try doing something differently. I don't think this should be a dictatorship where one person does it, but at least we should try.
Well, I've been tracking his views for a long time. Speaking specifically about vaccines, there is no better bang for your buck than a vaccine. I'm older, I think, than everybody else here at the table. I remember seeing kids with polio. I remember seeing measles and encephalitis. The amount of good that vaccines has done is impossible to overstate. And I think the risks associated with vaccines are vanishingly low. There will always be adverse reactions to any medication or any vaccine or whatever intervention you want to pursue. But if you look on balance and what we save in the way of birth losses, encephalitis, paralysis, death, there's just no question, but these are beneficial.
And there's the mixture of I think that the difference between what the two of you is saying is you're talking about the health part of what RFK is talking about, and then you're talking about the vaccines part, which is completely unfounded that he's pushing all this vaccine misinformation. It's hard to separate the two.